It is a huge honor today to be podcast interviewing Dr. Thomas Meyer from Des Plaines, Illinois, where Ray Kroc started McDonald's.
Yes.
What, do you remember what year that was? Or
I don't
there should be a big museum there.
We went there, though, as I walk up McDonald's. You know, you walked up, they had a window there. And
his movie's coming out any day now.
Oh, really?
Okay. The Founder. I can't wait to see it.
So there's a museum there.
There is
old cars in there and everything, and they got a couple of mannequins. And,
really, they do?
Yeah, it's really cool. It's really cool.
And then the McDonald's brothers actually started in what is it in California? Starts with a D. I saw the first McDonald's. Dorsey, Dorrance. But anyway, Dr. Thomas Meyer, DDS, MICCMO. What does that stand for? MIC?
A master in the International College of Cranialmandibular.
And that's where we're at now. So you were the past president. Well, here, let me read your bio. Has enjoyed practicing dentistry in the Chicago suburbs area since 1993. He proudly continues to provide excellent care to the community, as his father did the generation before him. Dr. Meyer, dentist, Mount Prospect, Arlington Heights, Des Plaines, Illinois, strongly believes that all of his guests are deserving of the highest standards of quality care and treatment. To fulfill this promise, he stays committed to continuing education, advanced technology, and the latest procedures used in his office, along with top-of-the-line patient amenities. So basically, tell them where we're at, because you were the past president of this group.
Right. The International College of Craniomandibular Orthopedics, and what our organization is about helping people just alleviate them from pain and suffering, and trying to be a tooth doctor rather than just a tooth dentist, and really evaluating the whole body, okay, and getting people better. And being a master in it, I had to, write a thesis, and what my thesis was on is how treating people and basically making them feel better, making their jaw position a lot better, opens airway, which it creates a better life, a quality of life for patients. So that was, and I did with a CBCT scan, and measured it all out and everything like that. So in our philosophy, in our college, is if it's not measured, it's not fact. So that's what we base it all on, trying to do science and measuring, and that's how we get from point A to point B.
So as a past president, why should one of my homies listening right now become a member of this group?
Because I think it's educational. Really, to learn as much as you can to treat your patients, especially pain patients, TMD patients. So ICCMO is one of those organizations that it just has smart people in it who are willing to lay out a hand to somebody and help them on their journey to answer questions that are not answered in their typical practices.
Do you still practice with your dad?
My dad is he's retired. My mom died about 25 years ago.
Your mom passed away 25 years ago?
Malignant brain tumor. Yeah, she was diagnosed in June and died the day after Christmas. So, and was diagnosed. She went to a neuromuscular dentist, Dr. Ira Shapira, up in Gurney, and he did a neurological exam on her, and then realized that she needed other work to be done other than just trying to solve her migraines or headaches, and went and had a scan done and developed, had a brain tumor, and it was then 6 months. It was the worst time of my life, but.
And that was 25 years ago?
That was about 25 years ago. So
and how long have you been practicing?
Since 93.
So what year did she pass?
That was when I was a junior in college.
So she passed before you even graduated?
Yeah, before I even graduated. So my dad, my brother's a dentist, okay, and he took over my dad's practice at the time. And my dad...
Because your dad couldn't really practice after his wife died?
No, he could practice. He just wasn't fulfilled. He decided to stop. It was funny you talked about the whole nun-priest thing. He went back into the seminary, and he's now a Catholic priest.
No kidding.
Yeah. I'm one of 10. I'm one of 10 kids.
So wow. So Meyer? What is that? What ethnicity is that?
German.
German.
Yeah.
So
German.
he's German Catholic.
German Catholic. Yeah.
Wow.
Yeah. And so he married me, baptized my 5 kids, gave them all the, first communion, first confession, all of it.
Oh my gosh! So we have to. Does he use email?
What's that? Yeah. Oh yeah. Yeah.
Okay, so you have to email him and me, and then I'll reply to me and my oldest sister. Because how old's your dad?
He's 83 right now.
He's 83. I'm 54. I think my oldest sister is 60, but she's having a lot of Catholic philosophical issues. Your dad would probably be an amazing role model for her. Would you think he's been
an amazing role model to me, so I would have to say absolutely yes to anybody else.
And they'll have something in common. They'll both have a crazy brother that's a dentist. That is wow! What an amazing story. So, your brother's a dentist too.
Yes, in South Carolina, in Greenville. Shout out to Jim there.
How did he? So where did your dad practice?
He away in Des Plaines, and then Jim took over his practice. Waited till I graduated from dental school in '93, and then he left to go to South Carolina. So I took over the practice.
And why do you go out there? Just chasing the Wright Brothers?
I think his wife's family moved there, and they're originally from Pittsburgh, but moved down to I think he lives in the Greenville area, so they moved around that area. So that's where she wanted to go, and so he said no problem.
Well, I would think if your wife's family lived in Greenville, South Carolina, you'd move to Brazil. No.
It's beautiful.
I know.
It's beautiful.
It's golf course.
Golf courses. It's like
and that's where the Wright Brothers were, right?
Yeah, exactly.
Did you read that? They just come out with the book on there. Did you see that book?
Yeah.
Did you read it?
I didn't read it. I did not read it.
Oh my God! Did you read that, Mac?
But B&W is down there too. They got a big plant down there, and with.
The Wright Brothers, that was an amazing book. It reminded me a lot of. I mean, he bought a printing press, then he was a bicycle operator, but he just had that natural curiosity, which is something you see in so many successful people. And I always wondered, can you teach that, or are you just hardwired, born with that natural curiosity? I mean, I even see it with kids. Some of my nephews and nieces. Every time he explains something, but why? Yeah. It just never stops.
Yeah.
And they're curious.
Yeah.
And the other kids, they don't even care.
Right, they don't care. Right.
But the Wright Brothers, I mean, it's a printing press, it's a bike operator.
It's crazy.
And that plane, I had no idea how many. It was 3 years of dragging stuff out there.
Yeah, it's amazing. Yeah, it's quite. Yeah, it's.
So let's get down to what makes you passionate about dentistry?
I think I had a history of it just with my dad. He's actually the one that, and I know you interviewed Bob Jankelson and got him on the podcast, but he was, that technology with Myotronics and the EMGs and the TENS unit. My dad was one of the first ones to kind of come into that and start using that with Bob's dad, Bernard. He did my dad was just a forward thinker. So in dentistry, he made it smart, practical, and helped people out. And that's what my passion is. My passion was what my dad presented to me a long time ago. And that's my passion, is just treating people and getting them better, feeling better. And not just one tooth at a time. I mean, I look at patients a whole different way compared to a lot of my colleagues. So that's my passion. Just going into practice, knowing I love it every day, and if you don't, I don't know how you walk in the door, So.
And how do you think you're treating patients, or how do you think you're looking at patients differently than a lot of your colleagues? What do you mean by that?
First of all, there's a lot of questions I ask that is not even dentally related, and people come in. I have general practice. I mean, I'm not doing TMD on everybody, but when you look at people, their airway, the malposition of their teeth, the way their tongue is positioned. Hey, are you not sleeping very well at night? I mean, and I could not do that unless I was part of this organization and other organizations to expand my education. And ICCMO is one of those that it's just you got to be around smart people to get to the top, And I'm probably not the top, but I know that people have problems, and it's more than just one tooth. So that's what I'm passionate about, and that's why I look at people a lot differently when they come into my office. Just like all the people who are in International College of Craniomandibular Orthopedics. We're all on the same wavelength, because we're not just individual tooth doctors. So that's what that's why I look at it a little bit differently.
If you're the smartest person in the room, you're in the wrong room. You know what I mean? You need to, because really you're the sum of the 5 people you hang around with the most. I remember when I was little, all my friends had an exact curfew. They had to be home at this time or that time or that time. My dad's curfew was, well, who the hell are you going to be with? And if I said I wanted to be with my best friend, I had to be home at 10 o'clock. But if I wanted to be with John Lease, who ended up graduating through dental school with me, he said, well, if you're John Lease, why would you need to come home? You know what I mean? You stay with that guy for 3 days and 3 nights.
Right.
So you're the sum of who you hang around with. You mentioned technology. And technology, so she's 25. She's $350,000 in student loans. She wants to be successful like you one day. What technology do you think she needs in a modern day practice in 2016?
Well, I think, Pam said it pretty eloquently. Communication is like the best technology that you can have in your office, and that comes from you. Your communication with your staff and your own personal communication with your patients. Other technologies are there to help you out, get from point A to point B. If you can't afford it, you got to, all the technology that I've had, I've just been able to afford it. I mean, and I remember, because this 20 years ago, I was a business of dentistry, reading your book, and, I came out here, went to your house. You invited me and my brother to your house. He was there. Your son was there, and you had the beds together, and they're all jumping around on the bed.
Oh my God! Wow.
And so that way, and I'll tell you, it changed. You changed my life about thinking about things, because had to change my practice. But he said, don't go in debt. Don't be a knucklehead. Don't put yourself under that pressure, because you're going to kill yourself. And I'm like, okay, I'm not going to do that. So all the technology that I have, I've been able to pay for. And I would never do it again without doing it. I know some things I do need. I need my instruments, but my best tool is me, my communication with my patients, and then doing the right things to get them better. And that's what being part of ICCMO is about. It's giving all those tools. Yeah, all the tools are there, and you can spend trillions of dollars, but I'll tell you what, if you're not happy and you're in debt and you're about to blow your head off, don't do it, So somebody's in debt, you got to have your basics. Move on, get with people, get your mentors together, okay? And that's what we do at ICCMO. We got mentors that help people get in their journey from point A to point B. And so that's the main thing. The main thing, get your mentors together. And a lot of times that doesn't cost a thing, Yeah, but if you want to go buy a Sarek machine, you better know you're going to pay for it.
Do you have a Sarek machine?
I do have a Sarek machine.
Yeah, so do I. But how do you... Is the soft skills, the empathy, the listening, is that something you're born with, or can you?
I think so. I think a lot of it is you're probably genetically, you can communicate a lot better with other people. Other people, they have to try hard to do it. But anything, like anything you do and you're not really good at it. I mean, I stink at playing the piano. But I took 2 years. I learned a couple songs, and all I do is play those 2 songs, but I play them well, and it brings me a lot of enjoyment to know I can finish those 2 songs off, But you got to try. You got to work at it. I mean, when I was a young dentist, I worked from 8 to 8 every day. Every day I worked from 8 to 8. And Friday I'd kick off. On Saturday I'd work till 4 o'clock, and then I'd go downtown Chicago and I'd rip it up, and Sunday off, and I'm back on Monday. But I paid my bills. And that's what happened. So, so you got to do what you need to do to get there. It's a tough road. Sometimes you got to work hard. That's all.
What? Describe what all you do in your practice. I mean, what are?
I'm a general practice. It probably makes up the majority. I'm about 70% of that. The other, 20% is orthodontics. I do a lot of ortho in my office. 20 to 30%, so maybe 60% general, and then 10% TMD.
Okay, so you say so 60% general dentist, 30% ortho, 10% TMD.
Yeah, I mean all my patients are all my patients I treat with the neuromuscular concept. So
Right.
it's 100% neuromuscular.
Okay, but I don't know what she's saying. She's saying, dude, I just graduated from school a month ago. We didn't do one ortho case. We didn't do one Invisalign case. We didn't place one implant. I mean, so they always complain they got out of school and all they learned to do was 50 fillings, 15 crowns, 5 canals of endo, and 1 denture.
Yeah.
So how does she go from, how does she learn how to do ortho? It's 30% of your practice.
Right.
How did you learn ortho? Is it fixed wire? Is it removable Invisalign?
It's all in it. It's all
where
in
did
it.
you go?
You know, you got to be trained, obviously. But when I was in dental school, my dad, I had just a great life where I had good mentors, and
Your dad did ortho.
Yeah, he did ortho, but he dragged me along with him. You know, like I worked in his dental office since I was 15 years old, to being his chairside assistant. And I don't want to do this, because you work too hard, But I'll tell you that the relationships that he had and all, it was just awesome. I mean, that's what impressed the heck out of me. But he dragged me along to ortho classes, so I was very fortunate about that.
Who did he learn from?
Jay Gerber.
Oh, yeah?
And let's see, who's it? John Widzik.
Yeah, oh my God.
John,
he's passed,
He's
hasn't he?
passed, yeah. But
Yeah.
that guy, he is a...
Was he Minnesota?
He was Minnesota, right?
Yeah.
And he'd come down to Chicago and have some forums and some, regional meetings that he would have. So it was good. But everybody used to fall asleep, and he had these huge hands, and he'd hit the podium, and everybody would go like this. He was awesome.
So Jay Gerber,
Brock Rondeau,
the Canadian.
Yeah.
Love Brock.
Yeah, and Brendan Stack, and so all these guys.
Jack Sheridan.
Yeah, they're all. I mean, you're all orthopedic, using appliances, and that's what it's like. You're treating different things. You're just moving teeth. I mean, any knucklehead can move teeth. That's you see patients come in. I mean, forward bicuspid extraction, they're ripping everything back, and what do they have? They're TMD problems. So it's you can move teeth all you want, but you got to treat the whole body when you're treating ortho, and so that's what I do in my practice.
So what percent of your ortho is fixed versus like removable clear aligners of something like Invisalign?
Yeah, I don't do a ton of it. I do probably about there's probably about 5% of is Invisalign.
And why is that? Because she's asking why only 5% Invisalign and 95% fixed wire?
It's my control
Right.
capability. It's better for me. But there's a room for Invisalign,
So you've been a dentist for 25 years.
93, so what is that, 22, 23, something?
23 years. And how old are your kids?
Ellie is 17, in college, freshman. Nick is a sophomore in high school, Notre Dame High School in Niles. And Matt is 8th grade. Dan is in 6th grade, and Joe is in 2nd grade.
How many do you have?
5. I have 5 kids, yeah.
The point I'm trying to make is what you just said, that Invisalign, the patient's in control, and with fixed wire, we're in control.
Yeah.
So if you took all your fixed and made it removable for like your 5 kids, what percent would I mean, for your practice, what percent of those boys in grammar school and high school would not be wearing their clear liners as often as you said?
A ton of them.
Yeah.
They just wouldn't do it. I mean, I have people come in all the time. I'm not even coming in because I'm not wearing my liners.
I have 4 boys, and out of those 4, 6 of them would have thrown them away in the trash can.
Yep. That's right. Yeah. They wrap it up and throw it away.
And then tell me that they lost it.
Or they sat on it. Yeah, they sat on it because it's in their back pocket or something like that.
So why would you recommend that they learn ortho?
Because you got to treat everything. You got to treat the whole body. And I think it was Alex said that orthodontists around our area won't treat the way I want to treat it, and so therefore I had to learn it. But I was, like I said, I was good enough to have my dad around to show me. I had mentors at ICCMO.
Okay, I want to tell you a real emotion that the kids have. Okay, they're in a small town, and they're in Beaumont, Texas, and they went to the study club, and they're afraid in their study club that if they do, I mean, he or she, both, they're both afraid, they're 25, that if I learn ortho, the orthodontist in the study club, he ain't gonna like me, and he's gonna give me dirty looks, and I'm not gonna be accepted into the tribe of the Beaumont County Dental Society. What would you say to that kid?
I'd say it's the tough part about it. It's a tough part because you get a lot of flack. You get a lot of flack, and I get a ton of it. But you know what? If you're honest, you believe in what you do, they know that, and they're going to trash you anyways. It doesn't matter what you do. I mean, even if you were just uprighting a molar or something like that and putting 2 brackets on there, I mean, they're going to trash you anyways. So you know what? You go out there with confidence, and if you have a mentor, sometimes that mentor can come with you and defend yourself a little bit. You know, you don't have to take it out on all this on your own, and that's what we do at ICCMO too. Is like we're a group. You know, yeah, we were. You know, everybody was an individual wolf, and now we're a pack. You know, so we like to attack those things. You know, and that's what gets you excited about dentistry, and you know that from Dental Town. I mean, Dental Town is all these people. You bring everybody from all walks of life together. I mean, it is just awesome. I mean, and I followed you. I've been following you for a long time, and it's just. You just did it right. I mean, you did it right, and it's just totally cool, you know. So,
let me ask you a very politically incorrect question, because I feel like you have the kahunas to answer. But do you agree or disagree with this? It seems like if I send, if I pull a tooth or not, or try to pull a bicuspid or insert it, the oral surgeon can care less.
Right.
If I try to do endo, molar, the endodontist doesn't care. If I try to treat a kid, the pediatric dentist, I've never even heard of any pediatric dentist caring to treat a kid.
Right.
What? But does it seem like the orthodontists are the only one of the 9 specialties where if you do something in their specialty, they get upset?
They do.
But do you agree with that?
I totally agree with that. Yeah, I totally agree with it.
You totally. So I agree. And the same thing in dental school. If you want to pull a tooth, they'll say, "Go try it." You want to try a root canal? Go try it. Everybody, go try it. And then you say, well, can I do an Invisalign case? Well, son, if you want to do ortho, you should go to ortho school.
Right.
It's like, what the hell?
Right.
Because when I look at the facts, 25% of all the American towns don't have one specialty. So why is the state school not training Eduardo ortho when he's going to go to a town that doesn't even have an orthodontist? And you just told Eduardo that if he wants to learn ortho, go to ortho. So my question to you specifically is, why is only one of the 9 specialties recognized by the American Dental Association not want to help or share? In fact,
maybe they smoked the wrong weed. I don't know.
I mean, look at Dental Town. Every specialty is on that town except for one.
Yeah. And
they wouldn't go on it. They had to have their own town. And I own Ortho Town, and I'm not allowed to go on my own website.
That's crazy. Yeah, that's crazy. But
isn't that weird?
Wait,
I own the site, and I'm not allowed on it.
Yeah,
that's Orthodontics 101. But why is that? And the only reason I'm asking is because the bottom line is she's afraid that if I start doing ortho, that Charlie across the street in my study club, who every time I go to the Bullwinkle Study Club, he's going to be over there giving me weird body language.
Yeah, and this could be part of it is that, okay, ortho does only ortho. You know, an oral surgeon can do many different things. Perio can do implants, and he can do surgery and, extractions. So maybe ortho is just, it's just only ortho, so you're taking away their business. And I think they just don't like, their toes to be stepped on, It's got it's a pride factor, too. And once you have pride, you're done. You hate everybody. So I don't get it.
So say what this group is again. The
International College of Craniomandibular Orthopedics.
And would you consider this a neuromuscular dentistry group?
I would consider it, yes.
Okay,
but much more than that. Much more.
So my next question is the same follow up. I said that of all the 9 specialties, orthodontists are the ones that don't like to share the most. I'll take it another step. Of all the areas of dentistry, occlusion is the most controversial.
Right.
If I went to 10 endo lectures, I would never hear an endodontist saying, "Hey, don't listen to that other guy saying using that. He's crazy." It's only But it seems like 12 endodontist lectures in a row, not much disagreement. 12 occlusion seminars in a row, it would be like going to 12 different religions.
Right, right.
Well, do you agree with that assessment or not?
I agree with it. Yeah, sure.
Do you agree with
that?
Yeah,
I agree with that.
You don't have to agree with me just because I'm...
No.
It's my
I
show.
I think there's so many...
You come on my show and call me an idiot.
No,
Please feel free.
Trust me, I have no problem. You're not an idiot. But there are 12, a bunch of camps out there. But you know what? It's science, and a lot of times, even within our camp at ICCMO, I mean, there's not one way to do it. I mean, there's a bunch of ways to get it, and you factor that into the practice that you're at and the people that you're treating. But I don't believe in a camp because I was taught it and it didn't work. So I'm going neuromuscular because I know that by doing certain things, it's helping out my patients way more than I did it maybe in that occlusal camp. And I don't want to label.
Well, I mean, we'll go back to that Reader's Digest. I remember when we were little, the Reader's Digest sent a person with study models and x-rays to 50 different dentists.
Yeah.
And how many treatment plans did he get?
You got
50.
Yeah, you got 50.
Do you remember that, Mac?
Yeah.
50. And this was state-of-the-art, perfect journalism.
Yeah.
And then it turns out that, you know where Eckberg got the idea for that study? A government agency did the same thing, but they went to 100. And out of 100 dentists, I think it was the NIH or the NHI or whatever, the NIH, no, so it was the government in Washington, D.C., though, only 2 of the treatment plans were the same, and those were the 2 dentists that said you don't need anything. So the 2 that said you don't need anything were the only 2 that was the same, and then the other 98 were all different because even the government was wondering what is going on in dentistry. So I want you to address that. Why on Dental Town could you not get, out of 250,000 dentists on Dental Town, how come you couldn't get 2 to agree that today is Friday?
Yeah, I don't know.
The nature. Would you say just the human condition?
It is. I mean, I think there's a lot of different thinkers out there. Like I surround myself with people who kind of think like me. Therefore, I kind of go in that circle. But there's crazy people out there too that are not going to even agree, and they don't even want to agree with you no matter what. So, and I've dealt with those people in the past too. But dentists have. It's a philosophy and it's an inbred thing. I think this is the way you are, and it's going to change. And dentistry is one of those professions that I think is just they're all going different ways.
Specifically for your occlusion, what technology did you buy for your occlusion?
From the Myotronics Corporation, I bought what's called a K7, and I also.
And by the way, I just want to promise that. This isn't sponsored by Myotronics. It's not sponsored by K7. I've never made a penny or a nickel and then other stuff like that. But the reason I ask these specific questions is because when dentists email me, they'll say things, well, you talked to that guy for 20 minutes about bonding, composite, and you didn't even say what kind to use.
Right,
I mean, they're dentists. They work with their hands. So what is a K7? What is Myotronics? And how much did it cost and why did you buy it?
It costs about $30,000. Probably.
That's a big investment.
Yeah, it's a big investment. Yeah, sure. But a lot of things are that I have in my office. So, but it's an investment that it helps me to get the bite right. That's what it does. It helps to measure muscles and muscle function. It also helps me to track the jaw movements in live time, and I can record it. So that's important to me. I can record it, it's data for me, and then what that data does is I extrapolate that and make a diagnosis to help me treat my patients. So that's
where does the name come from? What's K and what's 7?
Kinesiograph. 7 is just the model, so it's...
So what other technology?
A TENS unit. To help.
How much is a TENS unit?
Mac, how much is a TENS? Probably $1,000 to $1,500 or something. Two. Okay, 2,000. Okay, and
so you have a $2,000 TENS unit from Myotronic. Just one in your jar? I mean, is that something the patient takes home or just something you do?
Yeah, there's a thing called a BNS unit, which I have about 4 of them, and people can take them home, and they can help relax their muscles at home. And I have 2 units that I keep in my office that I use for treatment in my office. And I also use a CT scan. I have a CT scan in my office, too. So
What does that mean, a CT? A CBCT?
Yeah.
Okay.
Yeah, so it's important to me. I mean, it changed it.
Which one did you get?
Newtone.
Newtone?
Yeah.
Where's that?
I think I bought it from Dick Greenan, who's down at Atlanta, and so it's got a wide field of view. So
but Newtone, spell it.
Newtom.
Ryan, can you find it and text it to me? And what country is that out of?
I think it's some European country. I'm not sure.
European country?
Yeah, I'm not sure which one. Maybe Germany.
And how much was it about?
100.
And how long ago did you buy it?
4 or 5 years ago.
Okay, so my first question is, in 5 years, is it like a smartphone where now you wish you could trade in your Motorola for a new Samsung, or is it still
No, it's silly, and it will be viable for a long time because it's updates in the computer that they just do, So, yeah, it'll be for what I need it for, and the activity it gives me, and the information that it gives me. That will always be there. They just got to update the software.
So you're glad that you invested $100,000 5 years ago.
It's a game changer for
me.
Okay,
explain why. It's a big decision to spend $100,000.
Sure, it is. Well,
but you made $100,000 and 5 years later, you still say it's a good decision.
Oh, yeah.
Explain why it was a good decision and why it was a game changer.
Well, it's a game changer because I was about to go digital completely, okay? And the only thing I couldn't go digital on were my tomograms that I took and also my Panorex. So I needed something to combine those two, and I needed a CT scan. There's something I can get up real quick, and I can see the jaw, the muscles, look at bone densities, all that kind of stuff. So I needed all of that, and I knew I needed it.
Explain the difference between a tomogram and a pantograph.
A panoramic is just a panoramic view of the jaw. A tomogram are slices or cuts of the condyle to check for any abnormalities anatomically. And that's what that does. So tomograms are those. So you can extrapolate tomograms from one scan in a CT scan. You can look at all the teeth. You can look at all the bone density. You can check out where you want to sink an implant. You can do all of that in one scan. So it's wonderful. It's just beautiful.
Now, do you use that CBCT for other stuff? Like, do you place implants?
Yes, I do. Yeah.
So you do place implants?
Mm-hmm. Yeah.
And how many implants would you say you do a month or a year, or how significant is this in your practice?
It's not super significant. I mean, people want to stay in my office, so I probably sink maybe 5 to 6 implants a month, maybe.
So that's more than one a week.
Yeah.
So that's a lot.
Yeah.
That's
well, but it's not always that way. I mean, sometimes I won't have a little bit there.
So where did you learn? So you use the CBCT for TMJ, TMD, and implant. Where did you learn to place an implant?
Leo Moline. He's a dentist in La Crosse, Wisconsin, and he is one of the instructors at LVI. And he teaches non-surgical implant placement. With CT guided implant placement, which eliminates a lot of surgery, okay, when you're placing implants, and also you just know where to sink it to the millimeter where you're going.
Can you what's his name? Can you find? Did you text me that? Yeah, I did. Can you find this guy too?
And he's got a
what's his name?
Leo Moline, Malin. Yeah, and he's here at the. I'll introduce you. He's here.
Introduce me.
Yeah, he's awesome. He's really.
Why would you study from a cheesehead? What were you thinking?
He's got 5 kids, so he's right up my alley. Yeah.
So he's a cheesehead and he's broke.
He's broke.
And he has no money. So would you recommend that the young kids learn how to place implants?
Absolutely.
I mean, you think
absolutely. You need to have all that in even if you're not doing them.
So what about endo? Are you doing endo?
I studied under Frank Wine at Loyola, when I was a youngster, and did great endo. But I'll tell you, you're never going to get me to do an upper second molar, that's for sure,
So you refer...
I refer quite a molars out because it just, for the labor-intensive type of operation that it is, I don't like to, but I'll do the simple endos, you know.
So what percent of your molar endos do you refer?
Most of them. Most of the upper molars. I'll do the lowers. Those are usually pretty good.
So
and now with my CT scan, I can really look at everything, you know. So it's pretty cool.
So a lot of kids are wondering. A lot of kids are wondering about the PPO. In the last 30 years ago, it was all indemnity insurance. They pay a percent. Now it's all gone PPOs. 82% of dentists participate in PPOs. What are your views on PPO? Because they're wondering, should I sign up on all the plans? Should I not?
Well, I couldn't comment on it because I'm not part of any. You know.
So you're not on any PPOs?
No, I'm not on anything. I've always, and it's one thing my dad I inherited from my dad. He was never an insurance dentist. So I'm fee for service. Certainly we help people out with their insurance, but we're always out of network, and so that's tough. We got to educate our patients, and we have to, make sure that they know what a treatment plan is, before they get started, so there's no miscommunication, and the girls in my office do a great job. So really it works out okay. I mean, I'm not there to have somebody else dictate what I'm supposed to be doing in my office. So, I'm not a control person, but that kind of control I don't want, like somebody telling me how I could practice dentistry, so, but that's how we operate.
Some dentists think the sky is falling because of corporate dentistry. Agree or disagree? Do you fear corporate dentistry?
I don't like the model, but hey, there's always some.
But do you feel threatened by it?
Maybe if I lost some patients as a result of it, I haven't seen that yet. But there's insurance dentists around the corner too, and they could just very easily take my patients away too, because they get more bang for their buck at a dentist down the street. But it's just not the way I do my dentistry. Now, if I was hurting, like if I was out there, I had my bills to pay and my kids to go to school, and I'd probably do whatever I could. I'd work at a Dunkin' Donuts if I had to, So, but so far it's been okay. It's been okay. Since the crash. I mean, it's
crash.
Well, I know, but it's things they're not as good as they were, but I'm still, because of the philosophy I have in my office, my staff, the organizations that I belong to, and what I do. I'm so diversified that if one's not, part of my practice isn't doing good, usually the other one picks up.
So talk about your diversification. Follow that on. What are you diversified in? And you can do what?
Well, I could do crowns. We do 1-day crowns with the Sarek. Endo, perio. We do laser dentistry. We do Invisalign, orthodontics, implants. Dentures, neuromuscular dentures, and so we got all that, and we try to relay that to.
What are you, talk more about Sarek, because that's a huge decision. I mean, you said a CBCT. That was, what did you say, 90, or what did you pay for that?
Yeah, it's about 100, maybe more than that.
What was Sarek?
Sarek was, I think they're about 100 something.
So that's a big decision. So I figure. I'm thinking 12 to 14% market penetration in America, maybe.
Yeah.
That's a big decision. Talk about that. Why did you invest $100,000 in Sarek? You said 5 years after your CBCT, you'd do it again. It was a big game changer. 5 years. How long have you owned a Sarek?
Sarek, I've owned it probably about 6 years, maybe.
6 years. Would you do it all over again if you had to do it again?
Sure. Yeah, I do, because
you'd buy it again for $100,000.
It's a good marketing thing, and people come to my office just for that. As long as I can control the quality that comes out of it, I'm okay with that. I'm not just putting chiclets in someone's mouth. But It is, if you can afford it. Like I said in the beginning, I could afford it, and I did it, and it's produced for me. It's helped production in my office, and I completely wiped out a lot of my lab bills. so me, it was worth it to me.
So if you lease, it really doesn't cost $100,000 if you leased it, and the lease payment was covered by a lower
Yeah, yeah.
lab bill.
Certainly, that's an alternative.
Did that happen for you?
I did not lease it. I bought it.
You bought it out cash.
I bought it out. Yeah.
That's pretty impressive. I think something like.
Well, at the time, they had like a year, no interest, no payments for a year. I think it was on the Blue Cam, and so I'm like, that's a no-brainer for me. You know, I can produce this year, and then that'll pay for, hopefully half of it or whatever, or maybe close to that, and then I had the other money. So that's how I figured it out in my head. So
what do you like most about the Sarek machine?
I think it's just odd. It's like playing Star Wars game, or it's like a video game.
So you love the high tech of it?
Oh, I love every part of that, and it's like a CAD CAM machine. I mean, all the guys who are our tool and die guys are coming in, hey, this is what I got at my where I work, so
yeah.
You can communicate with so many different people because of the technology. It is a great marketing thing, and I think, like I said, as long as I can control the quality that comes out of it, and now with the new OED Max now, I mean the crowns are
the
strong.
new what?
EMAX, EMAX crowns, they're stronger. Okay,
yeah.
Before when it first came out, you were just doing the regular porcelain, and it wasn't holding up as well. Sometimes you learn to cut the prep a little bit different. But overall, it's been good for me. So yeah, and so I highly recommend it if you can afford it. It's from a newbie out there. It's a tough thing to swallow right off the bat.
I would say for me, what I liked the most about any of those things was just the magnification. I mean,
yeah.
I think getting loops was a game changer back in the day.
Yeah.
I remember the first time I scanned a prep with a Sarek machine and saw my prep 40 times larger.
Yeah,
I was like,
holy
what
crap.
what monkey had a drill in his hand? I mean, it's like...
I tell you, it did make me do better dentistry. It did.
I mean, you look at you're getting ready to obturate a molar root canal, and you pull down a microscope, you look down that canal, and you're like, someone left half a peanut butter and jelly sandwich down that mesiobuccal canal. What idiot did that? So I think magnification is always the biggest.
Is key.
And that's why I tell people that magnification is amazing. So put your dad hat on.
Okay.
She's 25. She just walked out of school. She's really worried because she has $333,000 of debt.
Yeah,
what would you tell her? Your dad was a dentist. Now you're a dentist. Put on your grandpa dad hat and tell her. What would be your best advice to her?
You just got to go out and work. You got to work hard. Just work hard and do what you can do to pay off your bills as much as you can in the shortest amount of span you can do it. You got to crawl before you walk. I mean, you're not going to have the best time in the world doing it, but you got to work hard. That's one thing I would say. Don't go in debt. Don't add stress into your life. You're in debt already. You got to pay that off. And then do whatever you can. Work wherever you can. When I came out, I wasn't as busy as I should have been. And I had to work other offices. Even I was working hard in my practice, but for the time being, I had to pay my bills, and I knew how much I had to bring in. So I was working in other offices just so I would have the necessary money to pay for my bills every month. So and I did that on Saturday. It wasn't taken away from my practice. I did it. I worked a couple Saturdays a month, and then worked Saturday at another office just to bring in some extra income. So you got to do what you got to do. You can't sit on your arse and expect to get anywhere. So that would be my...
Well, thank you for being the past president.
Yeah.
I know they, what was that, about a six-figure salary they paid you to be that?
It was so,
Did
yeah.
they fly you around in a jet?
Yeah. You had a corporate jet, the new car,
I'm always amazed at the volume. Are you a member of the American Dental Association?
Yes, I am, yeah.
So am I, and it seems like every dentist I hear that complains about these, like the ADA, I was saying, God, there's like 10,000 of your homies that volunteer. They're volunteer, and the only thing you can do is just badmouth it.
Yeah.
I mean, how much money do you get paid to be the president of this organization?
That's a big fat zero.
Yeah, that's a big fat zero.
And I put in a lot of blood, sweat, and tears and money into it, which I don't mind. I don't mind because what I get out of it is so much more. you know, so that's why I do it. And that's why you do what you do, you know, and I mean, you got a ton of friends just from Dental Town. This is what I got. You got people around you who you want to be around and be passionate like you are, and that's what I am with ICCMO. ICCMO is an awesome organization, and it has the best people in it, and you have the best people, and that's the way it should be. You should be passionate about the people that are in your organization. So it rocks, and that's why I was the president, you know, so... and I do it again in a heartbeat.
So what percent of your patients think you look like Tom Cruise?
I wish a lot more of them.
Did you get that before? Did you get that?
I've got it a few times,
Oh,
yeah.
you've got it a million times.
I dated a girl in college. She's like, "You look like Tom Cruise." I said, "Come here, sweetheart." I had to work hard on that one.
The only thing on you that doesn't look like Tom Cruise is your midline's on. To be Tom Cruise, your
he's like over here, isn't he?
Oh my gosh, man, that is.
I think he had ortho for a while to try to, but I don't know if you could straighten that thing out.
Yeah, it was really significant.
Yeah.
So he must have been a very strong thumbsucker to the side.
It could have been, yeah, or maybe he had a tooth that was out on one side,
or missing.
Yeah, I heard he had a lot of TMD issues too. Yeah, he having a lot of stress in his jaw and stuff, and was having headaches, and they were. Yeah, he's popping pills while he was making his movies, you know. So I read that in an article. So, but yeah, it's there's just looking at people. I mean, we're in the looks business, you know, and
I know.
Your teeth are like you smile and you just want, hey, that's.
It's so funny. My whole life, you walk out of a movie, they'll be talking about a character, and I'll say, "Is that the one with the funky canine, or are you talking about the lady missing the bicuspid?" And they're like, "What?"
Well, how about that guy from Friends? He's got the 4 veneers in the front. And you can just totally tell. I mean, it's like, what were you thinking? You're like a movie star. Put them all the way back to your smile line. You know, what is it?
Well, seriously, thank you for all that you've done.
Howard. Thanks for coming out and being part of our organization.
Honor was all mine.
I'm totally impressed, and thank you very much.